Malihe. Malahi.
Malaiha.
Malahi.
Malie. It's the Malie Clinic.
The Malie Free Clinic is a nonprofit organization that serves people who are under 150% of poverty level and uninsured. We provide free health care to those folks through the generosity of donors and foundations and lots of volunteers.
I feel like the most fulfilling thing at Malihe is that the fact that I'm working with other students and learning about my profession, but I'm also helping a real life patient who actually really needs help, and they're at a disadvantage either because they don't speak the language, they're refugees, and they need our help too. So I feel like it's this community experience where we're all helping each other. They're helping me because I get to learn and I get to use my knowledge to help them in a situation that they wouldn't normally have because they don't have insurance.
Not only are students get a real life experience as a student working as part of a team and working with different types of healthcare providers, they get to work in service, and if you practice serving others as a student, you will do it in your career.
Here at Malihe because it is something that I did when I was a pharmacy student in a similar clinic in Portland, Oregon, and I learned so much from that on-the-fly kind of what's going to walk in the door next experience, and I really want to give our students that experience as well.
I think it's really rare to have a medical school where you can go in as, in my case, a first-year medical student and basically be able to act in the capacity almost like an intern and be able to interact with an attending physician. And also as a first-year medical student and a second year, it gets really easy to get completely bogged down in the disease processes and the physiology, and it sort of dehumanizes medicine to an extent. And so being able to come to Malihe has been really valuable, just having the opportunity to connect a lot of those diseases with people again and remember why we're doing this.
I love Malihe because it's an opportunity for students to really see what it's like to work in interdisciplinary teams and to really help people who probably need it the most.
I feel like patients at the Malihe Clinic really depends on us. They're usually they have low income, they don't have insurance, and we're really the people they can count on to give them the care they needed. So for many patients I work with, a lot of them have worked many hours a week, or they are and their conditions, health conditions, can be limiting factors in their lifestyle. So when I work with them to help them get better, I feel like I'm making an impact in their life. They're feeling better, their diabetes are well controlled, they're living a better life, and just general well-being, like overall, I think that's how I feel like I'm really making a positive impact in their lives.
I think the great thing about the free clinic is that it offers opportunities for the patients. And so one of my dreams would be that everyone in the United States has access to high quality primary care. And so I think that the clinic is a great opportunity for underserved patients to have a primary care home where they can go to.
The difference that they make for me is that then I feel like really comfortable to explain how I feel, and they really understand me.
Porque tengo la oportunidad de tener una buena salud, de poder hacer seguimiento a mis enfermedades y poder curarlas. Porque me hacen un seguimiento continuo, me llaman cuando no vengo y me han hecho ser responsable con mis enfermedades.
Okay, he says, I love Malihe because they keep me healthy and they care about me. They call me when it's been a while since I've been here, they make me be responsible about my health.
And so I love volunteering here because people really want to have a better life and they're willing to do what it takes, and it's just, this is the first step.
So I want to express my gratitude to all the donors
all the faculty and preceptors for providing their mentorship and for making this all really possible, implementing the pharmacy services for the students to come, help the community, and to just be able to grow in our learning. So thank you all. Giving.
Opportunity.
Warmth.
Enriching.
Genuine.
Perfecta.
Perfect.
Trip in Blanding was a longer trip. We had the opportunity to reach out to students at the local high school and talk to them about the dangers of prescription drug abuse, and also the dangers of over-the-counter drugs and other things that they may encounter in their home and what to do with them. So that was a great opportunity to build some camaraderie with the students and the younger people in the community, to talk to them about some of the things that they may not be familiar with.
I think it was really impactful to be able to go to the high school and present with Generation RX about drug misuse and abuse, and just to kind of provide not only education about medication use, but also to serve as kind of mentors and examples to the students, and let them know what else is out there and what opportunities are awaiting them outside of their tiny small town. From the student perspective, I think it gives a really unique opportunity to experience how healthcare works in a rural setting, and the differences that we can make in kind of our scope of practice and how it works there. I personally really enjoyed just being able to bring back the education that I've gained here to people that I personally care about.
Thank you so much for everybody who helps make this possible for us. It truly is an invaluable experience.